So you have read a lot about the DSM-5, and so I'm going to kind of take it a little bit further and look at what we need to do to diagnose a person who has an alcohol or a drug problem. So just in review, I posted a lot of information about the DSM. So just in review, what the DSM does is it helps us to diagnose mental health disorders. Hopefully you had a chance to look at all the diagnostic categories in the DSM, but for this course, we're going to focus on substance use disorders. So with that said, the terminology that we use has changed from over the years. We used to talk about addiction and dependence. The appropriate term now for a person who suffers with addiction or dependence is called substance use disorder. So substance use disorder covers all substances. And so make sure that you use the appropriate terminology. When we make a diagnosis, we look at these 11 criteria, and you'll note that the criteria doesn't specify drugs or specific drugs or specific substances, but we can substitute those in and give a more definitive diagnosis. So for example, when we look at diagnosing people, there are codes, and those codes are used to determine their level of the level of severity of their substance use disorder, which would in turn help determine placement in treatment. It might determine what insurance pays and things like that. So it's important to get the diagnosis right. Now, the only people that can diagnose are licensed, credentialed clinicians, licensed clinical addiction specialists, licensed social workers, doctors, physicians, things like that. So when you graduate from this program, you won't be able to make a diagnosis. So why am I teaching you about diagnosis? It's important that you know, so that when you look at someone's diagnosis, you really know kind of what's going on and what is being talked about. Okay, so according to the DSM-5, the substance use disorder involves a pattern of symptoms, and we're going to talk about these symptoms in a little bit, caused by substance that the individual continues taking the substance despite the negative effects. So that's the earmark of addiction. A person continues to use even though all this bad stuff is happening to them. And so we're looking at the criteria that the DSM-5 uses to determine whether or not a person has a substance use disorder. And here's the criteria. Using more of a substance than intended, or using it for longer than you meant to. So when we assess a client, we might say, have you ever tried to quit? And a person might say, yeah, I tried to quit. If they use more than they intended to, maybe they went to a party and said they were going to only have 1 or 2 drinks. They ended up getting drunk. That happens every time. That might meet the criteria. So you'll notice on all these criteria, there is some interpretation from the therapist. So it's a very important job of the therapist not to make a diagnosis flippantly. So if I say a consumer meets this criteria, as a clinician, I should be able to document what they told me to make me think that. The second criteria is trying to cut down or stop using the substance, but not being able to. So in an assessment, we might ask the consumer, have you ever tried to stop? Or what happens when you try to stop? So that's an earmark of a substance use disorder, when a person can't stop even though they want to. The next criteria is experiencing intense cravings or urges to use the substance. What is a craving? So a craving, if I was cooking brownies and you walked by my office, you might go, ooh, I want brownies. That's what a craving is, a craving or urge. So these are very intense with people with substance use disorders. Needing more of the substance to achieve desired effect, that's also called tolerance. So what that means is it takes more of the drug to get you high or to get you drunk or to get you where you want to be. So if you guys took SAB 110, we talked about tolerance. So tolerance is taking more of that substance just to get you the feeling that you desire, and usually you don't. So So think about anyone that you know that has a substance use disorder. How much do they drink? I mean, do you have people that you know that can drink so much more than everybody else? They probably have tolerance, and these are physical tolerance, and the next one, withdrawal, are physical manifestations of a substance use disorder. Developing withdrawal symptoms when not using the substance. What withdrawal is it is what happens to you when you stop taking the substance. For example, if a person who has an alcohol use disorder, severe, and they stop using, they might get the shakes. Sometimes they have seizures. If we look at the opioids, now the withdrawal syndrome from opioids is nausea, vomiting. It feels like you have the flu. Those are withdrawal symptoms. So these are the two physical manifestations, and the rest are behavioral. Spending more time getting and using drugs and recovering from the substance use. Neglecting responsibilities at work, home, or school because of substance use. Continue to use even though it causes relationship problems. Giving up important or desirable social or recreational activities due to substance use. Using substances in risky settings that put you in danger, like driving while impaired. And continuing to use despite the substance causing problems with your physical or mental health. So all these 11 criteria, we determine whether or not a client has these criteria by doing the assessment. And so the assessment asks questions that address kind of all these areas. Now, an assessment is not a checklist. We don't go, do you use more of a substance than intended to? We don't do that. An assessment creates rapport with the client, asks clients questions, and kind of has that relationship with the client. Okay, so there are 3 levels of severity. So once we determine which of these criteria our client meets, then we have levels of of severity. So substance use worsens over time. It is called a progressive disease, meaning that if it doesn't get treated, it gets worse. So how severe the substance is depends on the number of symptoms present. For example, 1 symptom may be at risk, 2 to 3 point for mild, 4 to 5 moderate, and 6 or more is severe. So we would diagnose somebody with a substance use disorder, mild, moderate, or severe, based on the number of 1 through 11 that we selected for that client. Knowing how severe substance use disorder is can help physicians determine the best course of treatment for that person. So what we're going to start looking at in upcoming weeks is how do we develop an assessment tool that addresses all of these criteria. So one of your homework assignments is for you to generate an open-ended question. That means not a yes/no question, that you could get this information from. So for example, so you're going to have 11 questions, 11 symptoms, and you are to develop a question for each. So for example, number 5, I'll give it to you. So a question to determine whether or not a person's having withdrawal symptoms might be, tell me what happens to you when you stop drinking. Like, what happens the morning after? And so that client will start talking about that, and then we can determine whether or not they are experiencing that. So that's your homework assignment. Again, if you have any questions or need any more information, please don't hesitate to reach out to me.